How does jaw clenching affect pelvic floor tension? Imagine holding your jaw tight without even realizing it. That simple action can actually influence your pelvic muscles in surprising ways. When you clench your jaw, it creates tension that travels through interconnected tissues and nerves all the way down to your pelvis. This connection is not just a coincidence but rooted in how our bodies are built. The tissues surrounding your central nervous system, called the dural tube, run from your brain down to your tailbone. When you tighten your jaw, this tension can spread along these tissues and fascial lines. Think of them as connective tissue highways that link your jaw to your pelvis. This means that jaw clenching often triggers a whole body muscle response. When you're under stress or feeling anxious, your body naturally reacts by tightening muscles everywhere. This includes your jaw, shoulders, and pelvic floor muscles. The pelvic floor is a group of muscles that support your bladder, bowel, and sexual organs. When these muscles stay tight over time, it can cause discomfort, urinary issues like urgency or incontinence, or even pain during intimacy. Interestingly, the relationship between jaw tension and pelvic floor tension starts very early in development. During embryonic growth, the structures of the mouth and pelvic openings form close together. Fascial tissues that connect these areas remain linked throughout life. So, tension in your jaw can influence your pelvic muscles because of this continuous tissue connection. Plus, your nervous system pathways and posture habits can reinforce this link, making jaw clenching a common contributor to pelvic tension. From a bladder health perspective, this connection is quite important. The pelvic floor muscles support your bladder and help control urination. If these muscles are overly tense or dysfunctional, they can worsen urinary symptoms. That's why addressing jaw clenching can be a helpful part of managing pelvic floor issues. Techniques like pelvic floor physical therapy, manual jaw muscle releases, relaxation exercises, and stress management strategies can all help reduce tension in both areas. In practical terms, relaxing your jaw can lead to a more relaxed pelvic floor. This can improve urinary symptoms, reduce discomfort, and promote better bladder function. Therapies that target both jaw and pelvic tension are often used together to support overall pelvic health. Remember, everyone's body is different, so it's always best to consult with a healthcare professional for personalized advice. Understanding this connection highlights how integrated our body systems are and how addressing one area can positively influence another, especially in the context of bladder health and pelvic floor management.